Good evening to all of you. This is a new thing that we have introduced this year onwards, hopefully, that every new organization which is joining SPAN will get a chance to talk about what they've done and what they are doing, and how it's important for them to be a part of the organization. So this time we have 5 people who are there, and I would like to give as much time as possible to them, not more than 10 minutes, of course, but since we've already delayed a little, I think a little extra time to each one of them. So may I request Jasmine to please come up first? Jasmine is a patient engagement and information manager at the Myelofibrosis Trust. Her work focuses on creating up-to-date data, accessible health information, and she is currently integrating osteosarcoma patients' parents into their grant review process. She led the development of ONTEX, a curated osteosarcoma clinical trial database, and despite reviewing over 1,000 osteosarcoma clinical trials, she will consistently write trials as trails.
Hello everyone, thank you so much for that introduction, and it's fantastic to be at my first in-person SPAN meeting. So as has kindly been said, my name is Jazz and I'm the Patient Engagement and Information Officer at the Myelofibrosis Trust, and we are a medical research charity dedicated to rare conditions including osteosarcoma. And I'm going to be talking you through our new curated osteosarcoma clinical trial database that we've been developing over the last year. And during this presentation, I'm going to go through why and how we developed this database. And also I'm going to talk a little bit about why our database is unique and why we're really pleased with the outcome. So to start with, our work in osteosarcoma started in 2021, although our charity has been established since 2007. Our aim was to fund research into osteosarcoma, but to also identify if there were any areas where we could support people and their families with osteosarcoma. And so we met with a number of patients, patient advocacy groups, clinicians, researchers, and we found out that there was a need for both accessible there was a need for accessible clinical trial information at an international level. So the next step was trying to work out what our clinical trial database would look like, what did it need to include, what search terms should there be, and again that involved meeting with a lot of people, having conversations, and then once we had an idea of what it would look like, passing it over to our web development team to do their magic, because I don't really know what they do there, but they do something, it's fantastic. So that's what we did at that point. Then it came over to me to start summarising clinical trials, because as I said, a key part was making clinical trial information accessible. And so we wanted to take the current osteosarcoma clinical trials that were out there and summarise them using patient-friendly language, getting rid of all that scientific jargon and just getting straight to the point of what the trials were trying to achieve and how they were going to do that. And so if you search osteosarcoma on clinicaltrial.gov, you'll find over 600 clinical trials come up. Fortunately, those aren't actually all osteosarcoma, and that was part of it as well, determining what trials were for osteosarcoma and what weren't, but that was a big part of creating this database, summarising those clinical trials. We then launched phase 1 of the clinical trial database, and this was just basically the first kind of beta version, let's say, that was on our website that people could use. And really, we wanted to get feedback about how it worked, what people thought of it, and we sent out a questionnaire and also had one-to-one meetings. And based on that, we made a few changes. So one of the big changes we made was also summarising eligibility criteria. A lot of people wanted to know whether a trial would be eligible for them or not. And although with eligibility criteria, you can't say 100%, we thought it was important to kind of summarise what it means when it says that you need to have a certain specific type of tumour, so things like that. So we summarised that, and then this year we launched our final version of the clinical trial database, ONTEX. So we gave it a name, tried to make it more memorable, and this is the final version of our clinical trial database. So if you go onto our webpage, this is what you'll see. You can initially choose by country and also choose by age, and then choose to either select recruiting trials or actually look for data about past clinical trials. There's a whole video of me kind of going through the whole motions of going through that database that you can go and have a look at, but now's an opportunity to really say why this database is unique. So First of all, it's curated. So what does that mean? As I've said, we pull clinical trials from clinicaltrial.gov to go into our database. Not all those trials that are pulled from clinicaltrial.gov, even if it has the tag osteosarcoma, will actually be osteosarcoma trials. So it is my job to go through and make sure they are relevant to osteosarcoma patients. In addition, we summarise every single clinical trial, and that includes if there's any publications on trial results, so anything published on PubMed, we will put the results into our trial database as well, so people can look at past trials and see what worked and what hasn't. We also have an integrated translation feature, so that making the clinical trial database accessible in more languages. And of course, because we had a clinical trial database, it needed a platform to be on. So we also developed a website, Osteosarcoma Now, that has a clinical trial toolkit to help people navigate clinical trials, which includes information on what a clinical trial is, frequently asked questions, and also kind of tips and tricks for prepping for an appointment if you're going to see your doctor. So I quickly wanted to give you an overview of what we've achieved in the last 6 months with OnText. So first of all, our database has been reviewed by people from 102 different countries, which is what we wanted. We wanted this to be available at an international level, and it has been translated over 2,092 times, which again, we are really pleased with. In addition, we've been collaborating with advocacy groups to link OnText from their website to ours. So with MIB agents in America, they now have this nice little box which on their website, which links to our clinical trial database OnText. And the last thing I just want to mention is that we are also trying to make an effort to make clinical trials more visible. And so we have been interviewing clinicians about recruiting clinical trials. We did 2 last year, and then we've done 2 this year. And we now have a patient advisory board, and we've talked to them about the clinical trial interviews, and they have really liked them. So it's something we're going to try and continue to do in the future. So if anyone here has links to a clinical trial and would like to have an interview, let me know. So thank you so much for listening, everyone. That was just a quick whirlwind tour.
That was really quick. I must say that was really quick.
I spoke too quickly.
5 minutes, you finished your time. So if there's any question, anybody wants to ask her. And it was very good work.
Thank you. I was being efficient. Of course you can.
Is there anybody who wants to ask a question?
And another thing to add, on our website, we do have a little map of kind of support groups, because we do get people coming to us and asking for support. And of course, we only provide the specific support. So I know that you've just started, so if you'd like to be included on our little map, let me know as well, and we can add your group to the map. Of course you can.
Thank you, Jasmine. Do you include patient cohort extensions? So say, for example, it's a trial for chondrosarcoma, but it then there is a patient extension, cohort extension for osteo. Are you including those as well, or?
So this is kind of yes and no. So if you look at kind of trials with extension cohorts and also basket trials, which will include osteosarcoma, that's a lot of trials. If we're approached directly, or we find a clinical trial on clinicaltrial.gov that mentions it will be osteosarcoma in addition to multiple other cancer types, we will try and include that wherever possible. To know, with our database at the back end, it doesn't just pull in osteosarcoma trials, it pulls in all sarcoma trials. And so we also catch a lot of trials which are not just osteosarcoma, but open to other sarcomas. Again, it's not going to be 100%, but we try and get as many as possible. And on our clinical trial toolkit, we explain that and also direct to other areas where people can find out about basket trials, etc. So yeah, we do as much as we can.
Thank you.
You're welcome.
Thank you. So you helped us save on some time. Thank you very much.
Thank you very much.
May I request Mr. Lakshay Nagpal to please come. He's from the Sachin Sarcoma Society, and he's from India. And the things that he had said is that Google and MIT and Forbes all got famous in 30 years. Where is his fame? Because he has had, in the 30 years, he has fought cancer 4 times. He has completed his MBA, and he has also traveled solo to 19 states of India. So he's done everything which I think anybody would like to come on the big list. So I think we should congratulate him for all that he has done. And he's also co-founded the NGO Sachin Sarcoma Society along with the other members with the purpose that patients shouldn't face the same problems that he faced during his treatment. Over to you, Lakshay.
Thank you, ma'am. So I really like all the sessions that I'm attending today. So really great work, you guys. And so I'll be starting off with the project efficiency project that we have been working on for the past few months, and this is basically the optimum utilization of the scarce resources. Okay. Oh, I can see here. Sorry. Yeah. So I'll be going through all of these things in a structured way, and I'm hoping to finish it in time. So let's hope for the best. And I'll be using the extra time she has. So yeah. So I'll first touch upon how this initiative got started. So back in 2018, when we started, we used to counsel patients. We used to just sit outside the OPDs, and as soon as the patient comes out of the OPD, we were the first touch point for them. We used to counsel them. We used to understand the concerns. We used to understand what is going in their head and everything, and we used to note down everything so that we can understand the treatment plan, what are the medicines they are taking in and everything. And we used to take regular follow-ups with those patients as well. And then after some time we realized that some of the patients are not using the medicines that they have been taking previously. And why we actually observed this data is because there was one patient that came up to us just outside the OPD, and they were crying like hell. And we wanted to understand, okay, why they are crying so much. And the obvious reason was they were told that they are diagnosed with cancer, and they don't have any funds to actually go ahead and go ahead with the treatment. So we wanted to bridge this gap. Okay, what happens if a patient doesn't have a fund or doesn't and if nobody else is going to sponsor their treatment, how are they going to go ahead with the treatment? So we wanted to bridge this gap. So what we did is we looked at all the data that we have written about the patients, and we observed this one single thing, that some of the medicines that are being used by the patient previously are not being used right now due to any XYZ reason. I'll tell you about this reason later on. But there was some medicines with the patients that were not being used. So we reached out to those patients. We asked them if they are willing to donate it, and if they have it, if they are willing to donate it. They said, yeah, we don't have any problem. It's waste for me. So we took those medicines and we donated to the patient who was crying. And right now we know that that patient is good, like it's cancer free. So we thought, okay, this is something really good. We realized at that time that, okay, this is something really good that we can go ahead with. And then we formalized this plan. We thought about this initiative in detail, and this is how it started back in 2089. Okay, now, so there are three stakeholders involved in here. First is the donor. The second is the patient who is undergoing the treatment. The donor is also a patient who may or may not undergo the treatment, and it can also be a caregiver. Okay, and the third is we, Sachin Sarcoma Society, how they play a role in this. And we like to call this model as P2P, not peer-to-peer, but patient to patient. Okay, so donor is the one who actually either we reach out to them or they reach out to us. Previously, when we started, we were the ones who were reaching out to them. But since this initiative got massive support and popularity, now donors are reaching out to us and saying that, okay, we want to donate our medicine because it's of no use to us. And the patient who wants the medicine, they are the ones who reach out to us majority of the times that, okay, we are short of funds, we cannot afford the medicines, so what can be done in this case? So at that time we look at the database and what medicines we can arrange from the donors, and we bridge that gap. Okay, so this is the overall summary of how the journey looks like. Now, I'll tell you a very interesting case study. Now you must be thinking, okay, I was an osteosarcoma patient, I underwent chemotherapy and I was given ifosfamide and cisplatin. Okay, now if cisplatin doesn't work in my case, another my bad. If I am unable to arrange cisplatin, I must be looking for some other osteosarcoma patient who might have cisplatin drug and they can give it to me. But in this, what happens is an ESPS patient is giving the sunitinib drug to a GIST patient. So we are not just looking at a single diagnosis, a patient with a single diagnosis helping the other patient with the similar diagnosis. This can be like mix and match also. Okay, and so now I'll touch upon the three stakeholders that we see previously, and I'll look at what are the reasons and motivation behind each of the stakeholders. Okay, now first look at the donor's reason behind it. Okay, so I told you about the XYZ reason that I told previously. So I'll tell you what X, what Y, what Z is. Okay, so the first thing is disease progression. Yeah. So so there are cases where the medicine needs to be changed if the disease becomes metastatic. Okay, and in such cases the existing medicine is waste for the patient, and instead of throwing them away, we reach out to them and we say them, okay, you can donate it to us and we can give it to the other patient. Okay, for example, if the patient is taking pazopanib and in the regular follow-ups, in the regular PET scan, they realize that the disease has progressed, the pazopanib is stopped. Now that pazopanib is waste for that patient. And we reach out to them because pazopanib has a very short expiry date. We reach out to them and we say, okay, you can give this drug to the other patient. And they're more than willing, they're happy to donate it as well. Okay. The second thing is the poor tolerance. Okay. Sometimes due to the adverse effects of a patient might face, treatment course is changed, leading to the halt in the existing medicine that they're taking. And this halt becomes useful for some other patient because the existing patient is not taking that medicine. If I take an example, if a desmoid patient is taking sorafenib and they faces a lot of hand-foot syndrome, which results in swelling, redness in hands and legs, so then the course of action is stopped, and that medication and that sorafenib can be used for some other patient. Okay. The third, which is an unfortunate demise. Okay, in this case, the caregivers actually reach out to us and they tell us, okay, there are some leftover medicines. If you can give it to some other patient. For example, recently, a UK patient actually UK person reached out to us and they told us that, okay, my mother was taking this medicine and she has expired recently. Can you take these medicines and give it to some other patient? And we said, okay, yeah, how did you get to know about it? And they've been following regularly on Twitter, and they saw this initiative on the social media things that we regularly publish on. And through that, they got connected and delivered the medicine to us. So these are the three reasons a donor is willing to donate. The donor's motivation is why donors want to donate it. Like, what's the motive? The only thing that we can think of is the psychological and the inner peace that they get, psychological satisfaction. So, and they also are not incurring any monetary burden just to make a positive impact to the society. So now we have looked at the donor's perspective. Now look at the patient perspective. What are the patient's reason of taking that donation? Okay. So the only reason that we have encountered till date is that they are from the economically weaker sections of the society, or they are from the lower income groups of the society, due to which they require this some medicines that they cannot afford. And secondly, if I take my example, when I was undergoing a treatment, if someone comes up to me and says, some credible support group like such and sarcoma society could have come up to me and said that, okay, we have been buying ifosfamide for every cycle of chemotherapy, take these ifosfamide for free because some other patient doesn't need it and you can go ahead. I would have taken it. So who would have ignored the free item that they're getting? Okay. And what is the patient's motivation behind getting getting the medicine? If they don't have a financial burden on them, they can focus on much more important aspects of their life. They can spend the money that they have been collecting for the medicine. They can spend it with the family. They can have a good quality time together. And the life expectancy also increases for them. How? Because previously they were not able to afford it, but now they are able to afford it. So these are the two things that actually improves a lot from the patient's perspective. Okay, and now this is another case study that I received this morning only, in which this patient is an IMST patient, and she was in need of carbogenitib, which costs around 90,000, and a patient who passed away some time ago. We reached out to them in this case, and we told them, okay, there is this one patient who is in need of this medicine. You must be having that. Can you please donate it? And they were willing to donate it because it was of no use to them. So we got the photo this morning only that the medicine has been donated to this patient. And these are some of the testimonials that we get after the donors donate the medicine. They express their genuine thoughts on the chat that they are very happy to do it. Okay. Now, how Sachin Sarcoma Society come into the picture? So we act as a bridge between the donor and the receiver. We also do some pre-quality checks, like we validate the expiry date of the medicine, we see the dosage, we see the authenticity of the medicine, and we also see how much quantity they are giving to the receiver. Okay. The third thing is that we also handle shipping charges if either of the party is unable to do that. Okay. And the fourth thing is that we also get a proof, just like I showed you so many proofs, that we also get a proof from the receiver that, okay, you have received the medicine, we want the proof, and it helps in maintaining our records, and we can also share it in public forums so that other people can get to know about it. So, and through which a UK patient, just like a UK patient came up to us and told us that we want to donate it. So this is how entire network builds. Okay. So till date, in the previous year, we have helped 75 patients, and the medicines that we have helped amounts to around 19,000 euros that the other patients have been helped with. And in Sachin Sarcoma Society, 5,500 patients are there, out of which 5,175 are a sarcoma patient, 200 are desmoid, and 125 are GIST patients. And we have patients all around the globe, and you can see the countries below. I'll just quickly go to the key takeaways and the learnings that you can get from this initiative. So the first one is, this project is innovative. We realized, okay, this is a gap. We analyzed the data and we went ahead to see, okay, this is how we can solve this problem. The second thing is, all of your organization can replicate this initiative in their own countries. Okay. The third thing is, this is sustainable. Even if we don't have any funds, even if we have limited funds, we can help one patient and connect one patient to the other patient. So this is a very sustainable model. And the fourth one is scalable. This is the data that I just showed you. This is just out of All India Institute of Medical Sciences, New Delhi, just out of one hospital. Imagine the impact that we can create if we extend to multiple hospitals. So yeah, but there's one thing that you have to always remember, which is communication is the main thing that you have to focus on when you are going ahead with going ahead with this initiative, because this is what actually bridges that gap. Okay, and these are some of the things that helped us in fulfilling this initiative, such as social media promotion, regular weekly support group meetings, just like I told, and the physical and the digital presence on which we regularly post our content. Okay, and what's next? What are we planning next in this initiative? The first thing is that we are trying to increase more visibility by scaling to other hospitals, collaborating with other advocacy groups. The second thing is, we also are we are also using technology to enable this solution and make this communication much better. And the third thing is, we are also not just limiting ourselves to the medicines, we are also including medical aids. Okay? So that's it from my side, and you've been a great audience. Thank you very much. sorry if I exceeded some time. Yeah.
One question, if anybody wants to ask this one. Okay.
Thank you.
And during, you have a question? Yeah, please.
Just I want to congratulate Miss Ivy here.
Yeah.
And I have a question that how many % of your cases could finish all of necessary treatment, because sometimes it's a long time needs the patient drugs.
Yeah, so this is based on the availability. So let's suppose if the patient is reaching out to me and they are in need of, let's suppose, Pazopanib, and we already have some Pazopanib, so we directly donate it to them. Okay, but if we don't have Pazopanib, we reach out to all the people who have been taking Pazopanib and we ask them, okay, if you are in need of that. If they don't need that, we ask them if they can donate. And if, let's suppose, in the worst case, neither of the donors have the extra Pazopanib that they can donate, so either we fund it from our own funds, or we actually reach out to different organization if they can fund it or not. But we try our best to actually help the patient who have come up to us in the need, and we just try our best. That's the thing that we can do. Yeah.
Thank you very much.
Congratulations on a very disruptive project. Quick question, two questions. Number one is, I see that it's only for sarcoma and that medicine. Are you transporting or doing any IV? And then also, how do you maintain the quality, make sure that the quality and do you accept open packs? Do you only accept closed medicine? How do you make sure that what you're getting is what, and that it's...
Okay, so the quality checks, just like I told in the presentation, we ask the patient for how much time they have been taking the medicine, how much quantity is left, and we also verify it from the doctor who have recommended that medicine to the patient. Okay, and then we also see the expiry date. We also see, okay, there are some labels on the medicine packs itself which we can scan and verify the authenticity of the medicines. So through these various checks, we validate the authenticity of the medicine, the first thing. And the answer to your first question, do we also provide IV? Right now we don't, because the shelf life is a bit shorter and sometimes we have to keep it in cold storage and everything. So right now we don't do it, but if possible, this is a very good idea that we can think upon and build, extend this initiative.
Akshay, may I request you to talk to people while you're during lunch, dinner time or something?
Yeah,
because
sure.
we'll run short of time.
Sure.
Thank you
I
very
will
much
talk
for
later.
an excellent presentation. May I now request Sandeep to please come up on stage. Sandeep is a ring sarcoma survivor. He had his treatment during 2007 and 8. So I've seen him actually in the stage when his treatment was being done. He is an active member of SPAGN Sarcoma initiative run by VK Foundation. And he's also the founder and CEO of Digi Swasthya, which he started during COVID times, which was really very nice of him to start work at that time when people were closing down. And I think he's done a good job about it. And he's also the president of there's an organization for children, and he's a president of the Kids Can organization. So over to you, Sandeep, and you have only 10 minutes. Sandeep is somebody who cannot say Sandeep in 10 minutes, so we have a little problem there. Okay?
So thank you so very much, ma'am. बहुत बहुत धन्यवाद आपको कि आपने हम thank you so very much to SPAGN for giving me this valuable opportunity to present my work over here. And thank you so much, Jyoti ma'am, Bandra ma'am, for guiding me, helping me, supporting me since 2007 when I diagnosed with cancer. So I'm from Sant Kabir Nagar, Uttar Pradesh. It is a very small village in India where is no good medical facility available. So I had so I took 8 months to know about my cancer, and the doctor told for the diagnosis, he said that need to remove the hand. So we went to Bombay and took 1 year treatment, 14 cycle chemotherapy, and right humerus bone replacement done. So actually the idea of disease was there come in year of 2020 when I was in village, and I saw that a lot of the cancer patients and sarcoma patients are roaming here and there, one district to another district, but they are not getting the right information, right guidance, or right diagnosis. So डिजी स्वास्थ्य जहाँ कम वहाँ हम, where is the lack of medical facilities, there will be डिजी स्वास्थ्य, the aim of the organization. So you can see the data of government of India, the lack of infrastructure, facilities, and in rural India, the lack of hospitals, doctors. So our services are, we have telemedicine centers where we connect to patients from rural India to cities doctors, and also we generate electronic medical record and refer them for further treatment in expert hospitals. So you can see the process of the telemedicine. So patients come in, we do all the checkups, and after that we connect with the doctor, and then we refer them to a diagnostic center, to pharmacy, and further hospital for their further treatment. And also we make sure that they will get up to 50% off on their diagnostic and pharmacy on their medicines. So here are some numbers. You can see that we have provided around 24,000 one-to-one consultation in last 3 years, and also we have 5 telemedicine centers in India, and also we did health camp around 709, and we have 120 plus doctors on board, including Tata Memorial Hospitals and other hospitals as well. And also we have saved around 42 millions money of the patients for their traveling and consultation fees, etc. So you can see the doctor's profile over here. We have topmost doctors of India. Those provides tele-consultation to patients. We go to door to provide the information, awareness, guidance. You can see the photos and the services we provide to the patients. And also we have the advisory board, and they always guiding us and supporting us how to run the organization and how to rightly support to patients. And we have a lot of success story. I want to show you about Manisha Kumari. Can you please play the video? It's just for 60 seconds. 60 seconds.
मनीषा जी, किस तरीके से आप पीड़ित थी और कैसे ठीक हो गई?
मेरा नाम मनीषा है, मैं बिहार मुजफ्फरपुर से हूँ। मेरे पाँव में दर्द स्टार्ट हुआ और पाँव में हार्ट हो गया कुछ दूर तक, और उसके बाद दर्द रहने लगा, तो हमने 1 महीना जैसे घरेलू उपचार होता है वैसे किया, और उसके बाद डॉक्टर से दिखाया तो MRI में कहा कि ट्यूमर है, आप बनारस जाओ नहीं तो बम्बई जाओ। हमने बनारस से दवा लेना स्टार्ट किया टाटा मेमोरियल हॉस्पिटल में, और वहाँ से कीमोथेरेपी भी स्टार्ट हुआ। फिर वहाँ बोले कि पाँव हटाना पड़ेगा, और फिर भैया ने हमें एक दिन कॉल किया, संदीप भैया ने, और तब पूछे कि कहाँ हो, कैसी हो, तो हमने उन्हें बताया, तो वही हमें मुंबई भेजे, और वहाँ मेरा सर्जरी हुआ। यही 5 मई को मेरा सर्जरी हुआ है, और अब मैं ठीक हूँ। बस इसमें है कि हिम्मत रखना है और जितना हो सके खुश रहना है, और जो काम कर रहे हैं पहले की तरह वैसे करते रहना है।
जी जी।
Thank you very much. I would request to Vandra ma'am to translate in English.
Thank you. Just to give a gist of what Sandeep was saying, his treatment was not his diagnosis was not done correctly in the village, and so he came to Mumbai with the fear that his hand will be amputated. But here the diagnosis was different, and so he was treated well and he became well. So he took it upon himself that once he gets well, he's going to do something in the village so that people don't have to face the same thing again. So before doing that, he joined a few NGOs to learn about the work and to become more professional in his approach to things. After working for a couple of years, he went back to the village. Unfortunately, that was the time when COVID happened. It was unfortunate for all of us, but it was fortunate for the patients who were there because they could get the guidance from Sandeep to meet out the doctors without having to travel. So that was a big thing. Most of the big doctors in Mumbai have supported him in this cause, and he has reached out to a lot of people to be able to get them guidance about treatment, about financial support, about all the things that are needed. And this girl here, whose video we saw, was somebody again who was in trouble, but because of the guidance by Digi Swasthya, she was able to, this is a TV clip, she was able to get well, she had her chemotherapy, and everything was done systematically for her, and that is how the whole thing came up. Sorry, I'm making a very small gist of what he said, because Hindi is a strong language, and I know that all of you may not understand what he might have said. So thank you, Sandeep. Any
thank you so
questions
very much.
anybody has? Okay, Sandeep, thank you very much. Thank you.
Yeah, thank you so very much. Thank you.
Continue doing the good work. May I request Angelica to come up, please? Thank you. Angelica is a member and representative of InfoSarcoma, the French patient advocacy organization for sarcoma patients since 2010. Her own son was under treatment. That's how she joined the organization. And in the organization, she covers topics around childhood cancer and AYA-related questions. Over to you, Angelica.
Thank you. No? Okay. Thank you. When my son, aged 13, was about to be diagnosed, he said to me, Mom, don't worry that I'm a little ill. There are people out there, they have cancer. At that time, I already knew that he had an undifferentiated sarcoma. And I knew it because we had the luck to meet the right people at the right moment. Today he's 26 and he's fine. As it's not all the case of everybody, we did the campaign that I'm about to present right now. But first, let me introduce our association. InfoSarcome is a French patients advocacy association for sarcoma patients. We exist since 2009, and our aim is to inform about this rare cancer in order to get better treatment sooner. We work closely with a medical board of experts in the sarcoma field. They check and advise on all our publications, and we found 2 to 3 research projects per year. Almost all of us know these stories about people who early in the stage of the illness don't get the chance to meet healthcare professionals with sarcoma expertise. And this might lead to errors in the diagnostic process. Our aim is to avoid things like, this is a tendinitis, this is a sciatica, a fat ball, a lump, a cyst, a hematoma. Far too often, diagnostics are established without prior imagery or biopsy. Or, on the contrary, sometimes signs are not taken serious by the first doctors consulted just because they are not aware. And correct diagnostics come too late. Our project to create a campaign with very short videos of the main symptoms started back in 2019, but we stopped it to not get overwhelmed with all the information about COVID. We started this campaign only recently on the main social media. The campaign consists of 3 short videos, each focusing on a different initial symptom, like joint pain, lump, and hematoma. Our objective is to help people, and we target the general population, which means patients and families, and all medical healthcare professionals. Because often the first contact of the patient might be a general practitioner or nurse, which have never seen and will never see a sarcoma patient in the whole life of their career. We want to avoid that imagery is not made and people rush to surgery without having a clear diagnosis. Our budget came from 3 equal parts of our stakeholders. First, our association. Secondly, the scientific community. And third, the pharma industry. We worked with an agency which is specialized on medical subjects, mainly in the non-profit sector. Our budget allowed us to produce 3 videos, which I'm about to show you now. As told before, one is concentrated on the lump which appears. Second is about the bone pain or the joint pain. And third is about the hematomes. All 3 are very similar. I expect to come up with a video. I don't. Just a second. Okay. In the meanwhile, I can tell you, as it's the video is in French. So this video has the text a lump under the skin bigger than 5 centimeters, which is growing since several weeks. Be careful. It could be a rare cancer named sarcoma. Don't accept surgery without imagery or biopsy. Your life depends on it. This is very scary, and the use of the skull was largely discussed in our group, but we aim to have a picture with, in publicity language, is really a hook, which can't be forgotten. And all 3 videos are on the same system. So this is one about the bone pain now. The bone pain or pain in the articulation that persists and that amplifies, even if you take medicine, be careful. Could be a rare cancer named sarcoma. Ask your practitioner for full analysis based on imagery. Your life depends on it. And the third, a bruise comes up without former impact, and it stays for more than 4 weeks. Be careful. It can be a rare cancer named sarcoma. Don't accept any drainage or puncture as long as the diagnostic of a sarcoma can't be excluded. Your life depends on it. We share this video since very recently. We started in mid of April on Facebook, Twitter, and LinkedIn. And I asked my son about the presentation, and here's what he says. The goal of this project was to create short and informative videos that can be easily shared and spread on social media in order to reach the maximum amount of people. Obviously, we want to go it viral with these videos to increase the reach as much as possible. So if one of you see them in your feed, please like and share and share and share. We're counting on you. We are also working on translations of these videos. Actually, they exist in German, English, and Italian. And it's possible to multiplicate them in other countries. So if you're interested, don't hesitate to get in contact with us, starting with a written message to our association, and further on, going in contact with our agency for a very small fee, for about €1,000. You can replicate these videos in your country and for your association.
Thank you very much.
Thank you.
Excellent presentation. And I think we will have to, looking at Michi and looking at Catherine, I think we have to keep the question answers for the dinner time, because I think we are running short of time. We still have one more speaker. May I request Alberto to please come on stage? Thank you. Alberto is going to present to us about his project, 2022 program of the FMPJC Scholarship Aid for Training and Research in Sarcoma. His organization is Fundación Mary PGZ Zeminot Casado.
Okay.
Sorry if I've mispronounced it.
Okay. First of all, thank you for to SPAGN for inviting us to make that presentation, and also I apologize for my English. In some time probably will not be good enough for this Congress. Well, first of all, this is our 10th anniversary. We were founded in 2013, and we create that program because we wanted to add our bit to one thing that was very, the word is few. It's a few knowledge, few patients, few expertise, few research, few of everything. And then we want to put our little bit in those niches where we can add some value to the whole process. For that, we create 3 lines of actions. And the first one was training in research, and we wanted to use at least 80% of our funds in this area. Awareness and expanding knowledge of sarcoma, no less than 7%, and comparison and volunteering, no less than 2%. The total size of the program was around 160,000 euros annually, just for training and research. For training, we first of all think that it's in the academic area where we have to work, because a lot, as all the speakers said before, a lot of doctors never seen or rarely seen a sarcoma in their life. Therefore, we start to work on the academic training area, and therefore create 4 scholarships for the 4 Master of Sarcoma of the European University in Madrid and the Spanish group of researchers in sarcomas. Also, in the 4th Master of Sarcoma, we create some prize for the best exam and also for the advanced sarcoma course. Also, we start with the nursing courses, oncology courses in sarcomas, because we understand that the nurses are very forgetting of everything, and they are the first line of action with the patients, and we wanted to add something to that area with the nursing. And also, we been working in the printing of 2 books, one for the malignant bone tumors in childhood and adolescents, another one with bone tumor manuals in collaboration with the SECOT. These one are the 2 main Spanish organizations in orthopedic. One is pediatric, another one is for adults. In the sense of association in the nurse area, we've done these 5 courses annually with the parenthesis with the stroke during the pandemic, because it was impossible to do it. But this year we are doing again in the one of the Spain reference centers in Madrid, and we'll do it in October. We had more than 300 attendees, and the overall assessment of the course has been increased with the year. It's a good course. Then once we work on the academic area, we thought that we need to do something in the clinic area. And in the clinic area, we start to create some grants. And as you see, one is the 9th, another is the 7th, another is the 6th, another is the 4th, because as far as we were established or stabilize our fundings areas, we create the different grants in order to provide that and stability in the future. The first one this year in 2020, last year in 2020, were that ones, and every 15th of March we launch the grants, and which are awarded at the end by mid of September, on the 20th of September, more or less, that is the birthday of Maripat, that is at the same time the Spanish Sarcoma Day. It wasn't a coincidence, it's because we asked for that. The last one is the 4th clinical fellowship in orthopedic oncology surgery. It's that one doctor is 1 year with another doctor in the one center of reference during the whole day and during 1 year. And we provide with finance, not in the total amount, but partially. These are the results of this 2022. And this is the people that we had, and you can see they are in different countries, in different areas of the world. Apart of that, in the research area, one we finished with academic, clinic, and research area, we create our triennial beca or grant for a research in sarcoma. And also, we participate in the scholarship for the Spanish group in researchers on sarcoma, and the 16th scholarship with one amount of 5,000 euros. And there was the doctor who won last year on 2022, and also our triennial scholarship of for research in sarcoma of 75,000 euros was also won by the same doctor, but with another project. Apart from that, and continuing in the research area, together with another entities, we are funding these 2 projects. The first one is one specific project research projects, and the second one is the phase 1 and 2 clinical trial case that it's a continuation of the phase 1. And we already got the authorization to start, and I understand that before the summer, we'll start with this trial with 1 or 2 patients. They are children. These are the overall data of the Fundación. In our 10 years of life, we've made more than 1,700,000 euros in scholarship, directly or indirectly. More than 46 direct beneficiaries of scholarships, 5 nursing courses with more than 300 attendees. We've got a scholarship for the Masters in Sarcoma of the European University and Spanish researcher group of sarcoma. We've made 2 printed edition in books. And in the clinical area, we got provide 16 medical rotations, 7 in center of reference outside Spain, 7 in nursing, 9 international service, 4 fellowship, and in other grants we've done more than 45 beneficiaries in different research projects.
So please close now.
This is, thank you at all, and now we are in the, and now we are in the process of assess all that action that we've taken during these years, 10 years, in order to assess the impact that all that actions have had in the sarcoma world in Spain, and try to put the measures or to move one or to block another. And thank you very much indeed.
Thank you for your excellent presentation. Thanks to all the 5 people who made their presentations, and we all came to learn so much. Marcus, there's no time. I think we can.
I know.
Okay.
First of all, congratulations for all your success and achievements. My question is, because I'm not able to understand Spanish, is it possible to translate the curricula, the programs you are doing into English so that we understand what is the content of these programs? I think this would be extremely helpful to understand if you train sarcoma specialists or sarcoma nurses, what is really the content? And maybe we could also think about to offer something like this from a European level, because as you know, oncologists' language normally, or doctors' language is English, so it should be very easy, maybe in collaboration, I don't know, with EORTC, soft tissue and bone sarcoma group or others, maybe to offer such a course as a European course, so that young sarcomologists, I would call them sarcomologists, are able to take part from different countries. Just an idea. So it would be extremely helpful to have the content, the program, and then maybe to discuss this.
Okay, no problem, and do it. Another thing is that in the different scholarship that we've provided is what is not funny, is the thing. In the academic area, there are young doctors, you know. When I start with the rotation or the clinical, the age of the doctor is a little bit higher. And then we cover the whole, we try to cover the whole circle, you know. Thank you.
Please take the conversation to dinner now. Thank you very much. And we've all learned a lot, so thanks for that.